Welcome to H&HN Daily. I'm Hayden Bush, online editor for Hospitals and Health Networks magazine, and I'm joined today by Mike Hrickiewicz, editor of Health Facilities Management magazine, to discuss HFM's 2011 Hospital Building Report. Mike, thanks for joining us today.
Thanks a lot, Hayden.
Mike, I'd like to start off today by having you give us an overview of the 2011 Hospital Building Report.
This is our 7th annual Hospital Building Report. It's composed of a number of different elements. The main one is a survey we do at the American Society for Healthcare Engineering, another AHA firm. With them, we put together a survey of 5,000 hospital executives and managers to learn about trends in hospital construction. The response rate was about 12%, which is 598 completed surveys. In addition to that, we gathered data from industry experts, as well as RS Means, which is a big construction data firm. We put those all together, and that's our annual hospital building report.
Mike, one of the things I noticed was that the 2011 actual budgeting from construction was a little higher than the original budgeting projections in 2009. And I'm wondering if health reform had any impact on that. Do you see that hospitals are beginning to work their expectations of reform into their activity, or are the projected impacts a little too vague right now?
It's hard to tell exactly because it came on the heels of a financial meltdown and recession, so you weren't going to have a lot of construction to begin with. But it did add a little more uncertainty to the situation. Eventually, though, it got to the point where the hospitals decided they had to move. You can't stay on holding pattern forever. They've been moving ahead with projects, and a lot of what they're doing now seems to be the way healthcare reform is leaning anyway. There's more investment in technology. There seems to be a lot more ambulatory projects going on. So I think whether healthcare reform is influencing this or not, they're kind of both going in the same direction.
Mike, I'm interested in whether you're seeing any regional trends right now in terms of both new construction and renovation.
Well, we've had a lot of replacement activity throughout the country, I think, and a lot of that hasn't died off even despite the slowdown. Really, for 2010, we've been kind of flat with 2009, at least from a lot of construction data companies' perspectives. I'm sure you could find numbers elsewhere that say different things, but that's pretty much what I've seen and what I've heard anecdotally. You could see the map here, what the highest activity is. In California, that's obviously the seismic stuff. Texas, I've heard, has been going well for a long time. You see Illinois and Indiana, that might be a little surprising, but those are replacement facilities. And our top category here, one thing you have to remember is $1 billion or greater, and $1 billion just ain't what it used to be. 3 major hospital projects here in the Chicago area, each one's probably between $200 million and $400 million. So do the math, and that's $1 billion.
Mike, I'd like to take a look at the facilities projects activity. Are you seeing any particular hotspots right now in terms of specific projects?
Well, as you can see from the charts here, nearly 3/4 of the hospitals are reporting renovation projects. Another 2/3 of specialty hospitals are undergoing renovations. In addition, we have quite a lot of infrastructure activity regarding physical plant infrastructure, data centers, energy plants. Most of that is going towards technology demands. There's also some patient safety component of that as far as the data center, hardening the data center, and the energy plant for emergency power and so forth. Beyond that, I see a lot of ambulatory activity. If you look there at the chart, there's new construction for ambulatory facilities seems to be going strong.
One of the analysts in the article observed that some of the specialty hospitals seeing a lot of activity right now reflects preparation for aging baby boomers. And I'm interested in whether you've seen any specific demographic activity around particular service lines. Is this a relatively recent phenomenon, or has preparation for increased baby boomer utilization been pretty steady?
Obviously, it's increasing. Cancer treatment hospitals have been the top specialty hospital under construction for the past 3 years in our studies. Also, we're seeing some more orthopedic projects. That kind of peaked at 2008, but it hasn't gone away either. Also, cardiology has been big for a number of years.
Well, Mike, thanks for coming in today.
Thank you.
Thanks for listening today. For more information on HFM's 2011 Hospital Building Report, visit www.hfmmagazine.com.